Okay, class. In this video, we are going to study the irregular menstruation. The irregular menstruation refers to the abnormalities in the length of menstruation cycles. This includes an early menstruation, delayed menstruation, or an irregular menstruation. These may or may not accompany with the abnormalities of volumes of the menstruation blood. The abnormalities of volumes of blood, of menstrual blood, these are actually individual diseases, which we didn't introduce in this program for now, but you can refer to your textbooks how to treat the abnormalities of the volumes of menstrual blood. In order to discuss the irregular menstruation, we need to understand what's a regular menstruation. Menstruation in female, according to 黄帝内经, the ladies have the characteristic of 7. What does it mean by 7 is every 7 years, their body's developments have some changes. So, for example, by the age of 7, they start to change their teeth. By the age of 14, when 7 times 2, 14. So 14, the girls start to have menstruation. Once they start have menstruations, so they may conceive. By the age of 21, the wisdom teeth will grow. By the age of 28, so that's 28, 28 is the peak of the body development. By the age of 35, they start to deteriorate. 35. Okay. By the age of 42, they start to see wrinkles. The hair start to become gray. By the age of 49, the 7 by 7, the menstruation start to stop. And once the period stop, the patient may not be able to conceive. The ladies may not be able to conceive. So according to the theory, the ladies, they have the characteristic of 7. What has changed in these 7s is the kidney qi. So it described as in the 2-7, at the age of 14, the girls develop into abundant kidney qi. That's why they have menstruation. From this clause, we will understand that the menstruation is from kidney. This is because the menstruation also related to the reproductive system. So that's the kidney qi. The kidney qi is very important for menstruation. The kidney, if the kidney got problems, the patient may present, the girls may present in abnormal menstruation, may present in abnormal body development. However, in the treatments, we also need to identify the irregular menstruation is due to the problem with menstruation or due to other diseases. So the principle here is if the patient suffers from other diseases and results in irregular menstruation, you're going to treat the other diseases that onset first. Then the menstruation may recover automatically once the initial disease has been healed. if the irregular menstruation starts initially, and then it results in other diseases, you're going to treat the menstruation first, and then the other diseases may be healed automatically. So I hope I'm clear here. We are talking about which disease, if the patient suffers from 2 or more than 2 diseases, which disease are you going to focus on? If the patient suffers from other diseases and then followed by menstruation, the problem with menstruation, you're going to treat the initial disease. You don't have to focus on menstruation. However, if the patient suffers from menstruation initially and followed by other diseases, you need to focus on menstruation first. So that's the first principle when to treat the menstruation problems. When treating menstruation, because of the relationship between menstruation and kidney, so our treatments will focus on the kidney, because kidney also the soul is the source of menstruation. The second principle is treating the manifestations or treating the root cause. So this will depend on the situation. In the acute stage, you need to relieve the manifestation, relieve the symptom. And then in chronic stage or stable stage, you can focus on the root cause. For instance, if this patient suffers from dysmenorrhea, painful menstruation, you need to relieve the pain, stop the pain immediately, no matter what techniques you are going to use, acupuncture, herbal medicine, or even painkillers. If severe pain, you have to do something to stop the pain. So in the acute situation, for emergency, you need to stop the pain, to relieve the manifestation. And then in the chronic stage, you can focus on the root cause. The root cause, which are the kidney, can be the kidney, the spleen, and liver. So mostly we refer to kidney, spleen, and liver. Why we emphasize the kidney, spleen, and liver is because this is also related to the age of the patient. In youth, we're going to focus on the kidney because this is the development of the kidney. The development is also related to the strength of the kidney function. This kidney function made from body constitution, which means from innate kidney essence, also may related to their diet. In the mature age, we're going to focus on the liver, and after menopause or in senior patients, we can focus on the spleen. So for irregular menstruation, all what we need to focus on, the first 3 organs that you need to focus on is kidney, spleen, and liver. Early menstruation refers to the menstrual cycle that's earlier by more than 7 days than it used to be, for 2 continuous cycles. So the definition for all these are quite easy to understand and memorize. 7 days for 2 cycles, 7 days or delayed for 7 days, more than 7 days for 2 cycles. Irregular menstruation is either early or delayed, which means either earlier than 7 days or more delayed more than 7 days for 3 cycles, 3 continuous cycles. So if a patient comes to you and says, "Hey doctor, my periods comes earlier, 2 days earlier than last cycle," in this situation, we don't treat this patient for menstruation problem because 2 days or 3 days doesn't consider as early menstruation. especially if only one cycle. We don't interfere at all. We need to wait for the second cycle and see if it can become normal or not. If the period still abnormal, still earlier 2 days, is not considered as the early menstruation cycle. It must be more than 7 days. Early menstruation, less than 21 days. The reason for 21 days is because the normal cycle is 28 days. So here we're going to introduce how to keep the records for period. So LMP, you can write there. This is the last menstruation period, means the latest one. And then you can, for example, the latest one will be, just for instance, 8th of September, okay, 2021. And then for you're also going to ask the patient, yes, the normal cycle. They will tell you the 3 to 5 days, normally 3 to 5 days. And the cycle is 28 days to 30 days. So you're going to write in this way. So when I see this records, I will know that the last period came on the 8th of September. The normal cycle is 3 to 5 days. The menstrual cycle is 28 days to 30 days. And then you can write the color, light red or darker red, with clots or knots, breast distension or not. You can use the signs to see there's a lot of clots or a little bit of clots. So if a little bit of clots, you can use 1 plus. If a lot, you can use 4. So you can help you to know how severe the disease is, which means this is about 25%, this is 100%. So you can use these signs in your file. When you know the normal menstruation is about 28 days, then you understand that where the 21 days and 35 days comes from. 28 minus 7, 21, and plus 7, 35. Irregular, sometimes earlier, sometimes later, delayed. The common syndromes, Qi deficiency, blood deficiency, and kidney deficiency. Qi stagnation, blood heat. Blood heat can be deficiency heat, or it also can be the excess heat. So according to deficiency heat or excess heat, you're going to have different treatments, either to tonify the yin or clear the deficiency heat. The main points we're going to focus on room 4, spleen 7, spleen 6, especially for the deficiency. For Qi deficiency, you can add the stomach 36, blood 20, blood deficiency, blood 20, blood 17, kidney, Qi stagnation, and all these are quite similar to the other situation. Just in general, the early menstruation is due to heat. It can be either excess heat or deficiency heat. The delayed menstruation will be due to coldness. So keep this as the fundamental principles that you can memorize. But for early menstruation, you can use technique of reducing or cooling down. For delayed menstruation, you can use the technique of reinforcing or warming. Okay. So if you need to just write down these notes, for early menstruation, use a technique to reduce or to cool down the body. If the delayed menstruation, use the tonifying or reinforcing or warming. When you understand the early menstruation and the delayed menstruation, and then when we're talking about the irregular menstruation, the one when we refers to the one either early or delayed, then the most common syndrome may be the liver stagnation and kidney deficiency. Also, when you think about the coldness for delayed menstruation, apart from warming the body, you also need to remember that the coldness may also accompany with the blood stasis. So the patient may accompany with painful menstruation or a lot of clots in the blood. And then in this situation, we can use some techniques to activate the blood circulation. Because we didn't introduce the abnormalities of the volume of the menstrual blood in this program, so I just give you a general syndrome differentiations of how to analyze the abnormalities of the blood, the volume of the blood. So it can be either excess bleeding or scanty bleeding. So excess bleeding, in this situation, you don't need to think about the period. Just think about in general, for excess bleeding, how can we analyze excess bleeding? Excess bleeding may result firstly the spleen, because this is the lower part of the body. Excess bleeding, such as the spleen deficiency, qi deficiency, because the qi loses the function of confining the blood in the vessels. The spleen deficiency loses the function of confining blood in the vessels. So it can be qi deficiency, especially spleen qi deficiency. Then the patient may present as excess bleeding, pale color, and fatigue, reluctant to talk, pale complexion, pale tongue, thin coating, weak, thin pulse. So for the treatments, you can use some treatments to tonify the spleen. The excess bleeding also may due to heat, excess heat. So excess heat may enhance the blood circulation, may push the blood to move out of the region either in the vessels or in the uterus. So that's why excess bleeding. In this situation, the patient may present as a red color of the blood, sticky with clots, may accompany with thirsty, irritation, yellow urine constipation, red tongue, yellow coating, rapid slippery pulse. You also can accompany it with blood stasis. So for blood stasis, the patient will present as painful menstruation, a lot of clots, and bluish or purple tongue. The next one is the scanty period, scanty menstruation. The scanty menstruation, so physically, what we see is the patient doesn't have enough blood or sufficient blood during the period. So the patient doesn't have sufficient blood, which means deficiency. And the period is from kidney, as we explained at the beginning of this video. So the scanty bleeding, we're going to focus on the kidney deficiency because the menstruation is related to the kidney directly. Blood deficiency, blood stasis, and phlegm dampness. So for deficiency, we got two: kidney deficiency and blood deficiency. For excess, blood stasis and phlegm dampness. So these syndromes are the common syndromes that you can think about when you see patients, and then you're going to find evidence to support your diagnosis. In this video, we mainly discuss the irregular menstruation, especially the early menstruation, delayed menstruation, and the irregular menstruation itself. When seeing patients with menstruation problems, especially in patients in their late 40s, late 50s, or early 60s, especially if they present as excess bleeding, it is very important to have the health examination or the ultrasounds just to exclude the possibility of cancer, which is very common nowadays. So for your safe practice, it is always advised, especially for long-term excess bleeding, especially in kind of a senior age, especially in late 40s, 50s, and 60s, if the patient presents as excess bleeding for long-term or amenorrhea for long-term, the first thing you need to do is to exclude cancer, the possibility to exclude the possibility. The first thing you need to do is to exclude cancer. Thank you for your attention.